Why can't we create world-class healthcare with our clinical partners and the community? We see these folks that are doing world-class healthcare, and it's really something that we can and should and are compelled to do ourselves.
A typical day was me arriving 10 to 20 minutes late. I raced in the door. I had a stack of charts. I knew I had a stack of charts waiting in medical records for me. I would walk into the room. I'd open the chart, maybe before I walked in the room, and glance at the name. What was I supposed to do? And then I also just had this incredible burden of backlogged work. As a physician, I was all alone, having to accomplish those tasks.
I felt stressed out doing things for the doctor. It was kind of hard because I didn't have an idea of how to do everything organized.
At different desks, boy, it could get crazy up there. It was stressful. It was very stressful, busy. I was looking for a new job.
Okay. Before primary care renewal, it was good. I loved being a doctor, but I wasn't nearly as effective as I am now.
Well, I think it's clear that the system doesn't work for anyone. Some people really don't need a visit with a doctor, but that's the only thing that's paid for.
And so we're now finding ourselves in a mix of a broken health care system and people who can't access it.
It's going down. Diabetes, congestive heart failure, high blood pressure, a bunch of stuff. They raised my insurance about once a month until I got to about $800. Then I could no longer afford it.
So you're uninsured?
Totally uninsured. Business fell off, so I'm scraping by.
It's hard to fix because it's a complex system. There are many actors, both giving care, receiving care, and it's been hard in the past to activate that many parties around a common goal.
Someone has to sort of say, I can see that it could be some other way, and that's really what Dave did. He basically said, we're going to take 30 people to Alaska and figure this out. It was one of those crazy ideas that it was absolutely right.
Dr. Gideons and myself went to the South Central Foundation. They had what was called patient panels. Their registered nurses worked side by side with clinicians, with medical assistants, with LPNs. They were doing futuristic work, proactive care, bringing the patient in when they hadn't been seen recently. That model made real sense for our clinic and for the patient population.
We all knew that this was the model that we wanted to move towards. We could taste it, we could feel it, we could smell it. We needed to make the change, and so whatever it took.
You pull her chart, okay. A typical day now is so much better. I've taken some time to review my chart so that we can all kind of hear what's going on, interact, get charts pulled. As far as the flu vaccine, let's give it to them.
She can basically just come into one room and find all of her support.
I really enjoy my job. I feel like I'm doing a better job as a physician. Perfecto. I feel like I'm supported here as a team player, and I feel like I do a better job for those people that I'm here to serve.
It's fantastic.
So this is your antibiotic?
I'm getting in faster. I don't have to wait 3 or 4 weeks.
Take until they're gone.
And if I have an emergency, I can see a doctor right away also, which is nice.
It sort of created a safety net, I think, for their healthcare needs. And I think the patients have felt that difference as well.
And it seems like the people who work here want to work here. They're here because they want to be here. And that's really impressive.
Looking at the faces of the nurses that work here, I think they love their jobs more now than they did then.
We're making something that you can continue to do, not just for 6 months, not just for a year, but as part of your nursing career, and continue to be happy and feel like when you go home at the end of the day, I made a difference in the life of a patient.
We're really reaching people before they get to crisis and sort of establishing that relationship and establishing that network.
I do still feel like I'm dealing with acute needs, but there's time to say, by the way, how are you doing with your new diabetic blood sugar monitor, and is that working out? And do you need an appointment? And we have the access to give people appointments when they really do need them.
Data shows from February to now, the number of patients who've needed to utilize the emergency room has decreased.
Bravo. Other clinics are using us as a model now. Next year, we will have all of our nursing positions not carried on grant dollars at all. They'll be carried on our operational budget. We've been able to prove that the model can be sustained.
After about 8 months, when we've been doing this work with all the pilot teams, suddenly we heard that one of the clinics was going to move the model from one team to the whole clinic. When I heard that they were willing to put their whole clinic in this new model, I knew that we were really had found something that was really tapped into what was important to everyone.
I mean, I think bringing modern technology and the different tools that are out there to primary care is a new field. We didn't have that when we didn't have our data systems. We had no other way to do it. We had a telephone and we had paper and pen. That's it. So how can you study a population, and more importantly, how can you improve or renew primary care if you don't even know what you're taking care of? Here's an example of a provider panel. With that manageable panel, you can actually start seeing and trending that population and data outcomes. And that's a very different way of thinking. I can look at it from an individual user, one patient to one provider, to a population of an entire system. That it's not just about you seeing your patient in that visit, it's about your patients and your panel of patients that you see an outreach to on the times they don't come in. When I go to work, there is a group of patients that myself and my team are taking care of.
Every community, every practice has to adjust it and fit it to its own local culture. It isn't like there's something that's given on high. It has to come organically from the practice itself.
Now we're working as a team, and the team gets to make the decisions. So I think that's the paradigm shift, is going from somebody else deciding for us to us getting to decide. What would she say to me? Our team function is to really create a learning organization for the clinical teams so that they can learn how to be teams and also learn how to accomplish the objectives that they have and the patient outcomes for the population that they serve. It's through constant learning and taking a look at what we did, evaluating what we did, organizations are able to really design the work that they're doing. And so one of the things that we wanted to do was help people develop their skills around communicating on a daily basis and also managing conflict.
I sit around here and do all the work.
So today what we did was we started with a role play that some of the team, myself and other members of the team, did for the group. And we went over some of the basic principles, and then they broke up into groups, and we had the staff actually doing the role plays. Teams know what they're getting and what they're being prepared to do, and they know what they're missing. We've really done a lot of revision based on the feedback and the observations that teams have given us. The teams have taught us well.
It would be better for her.
People who are working in this primary care renewal, they're working hard. They're trying to change some of the behaviors maybe that weren't as effective, or behaviors that they need to develop because now they're working in teams, while at the same time they're trying to take care of patients. I just think that really needs to be acknowledged.
It is almost hard to put in words because so many people have done such remarkable things, and when we have 90 people in our learning center all working together, whether it's a doctor, a medical assistant, an analyst, it just is inspiring. We have a much better idea how to support a reorganized, renewed practice framework with payment methods.
We really entered into a conversation with our network about, well, if we have extra dollars to support your practice, how would you use those dollars to make your patients healthier? So it's a totally different approach rather than just sort of saying, here's the thing you have to deliver us and we'll give you money.
We're in a co-creative kind of enterprise that we acknowledge that complexity is ever present here and that we're going to be working together on continuously changing the system forevermore.